Hi, and welcome to the latest edition of the Research Sofa. Today I've got my colleague Noreen with me, and who's going to tell us a little bit about your research. So over to you, Noreen. Tell us a little bit about what you've been doing lately.
Well, thank you so much, Emily. I work in global public health. I'm an associate professor at the University of York. And most of my research is on addressing smoking in different populations in low and middle income countries. So the work that I've been doing at the moment is developing and evaluating smoking cessation interventions for different vulnerable populations in South Asia and also in Zimbabwe and Uganda in Africa. So most of my work really is looking at those populations, such as people living with HIV and also people with severe mental illness who are disproportionately affected by smoking. You find that there are a number of interventions that have been shown to help general population smokers to quit smoking. But those interventions have not really benefited these vulnerable populations who face considerable challenges when they try to quit. So what we've been trying to do is to tailor these general population interventions to the needs of these specific populations, and then test whether those tailored interventions are effective in helping people to quit smoking. So in terms of, if we look at smoking cessation, there isn't much in terms of evidence that has been done in low and middle income countries, particularly if you look at Africa and South Asia, which is really, which is really not reflective of the prevalence and the burden of disease due to smoking when you compare income countries and these low and middle income countries. We know that tobacco use, the prevalence of tobacco use is particularly high in South Asia, for example. And we also know that the prevalence of tobacco use is increasing, is rising in Africa. I can give you an example of Zimbabwe, where the prevalence of smoking, for example, in young people, in adolescents, is risen from less than 10% to about 20% according to the survey that was done in 2017. So we can see that there is need to generate evidence to inform policy and practice in terms of smoking cessation in these countries so that we reduce the burden of disease due to smoking. I think what we are trying to do here in low and middle income countries is to close the gap between, to address the evidence gaps, and also to make sure that the evidence that we generate is useful for decision making in terms of making policies and guidelines on smoking cessation, and also practice in real practice in routine care, in routine health care. So for our work, we really work closely with the healthcare workers and also patients and policymakers in each country, for them to guide us, to make sure that our research that we do is relevant for the context that they are working in.
Thank you, Noreen, for speaking to us today. It's been really interesting hearing about your work in the low and middle income countries and the importance of developing smoking cessation interventions for these vulnerable populations.
Thank you very much for the opportunity to talk about this, because it's really an important area that has not received much attention, but now I think we are beginning to realize that it's an important area that we need to address as researchers, and also is being recognized by policymakers. So this was a really, really good opportunity for us to showcase what we are doing on this topic, and also just to spread the word, to disseminate the importance of smoking cessation in the general populations in low and middle income countries in general, and also for these specific populations. Thank you.
Thank you, Noreen. And thank you everybody for listening to today's research sofa. Thank you and goodbye.
Bye.